Title of my study is Nutritional Status of Adolescent Girls in India. So basically, I am not a nutritionist, but I am a public health scientist. So anyway, but I am concerned about the nutritional status of adolescent and youth. The undernutrition during adolescence is a public health problem in less developed countries, including India. So the undernutrition restrict physical and cognitive development of youth and adolescents. Among the adolescent girls, the onset of menstruation results is a higher demand for nutrition. It is especially during the menstruation period, they demand more nutritious food and everything, but it is lacking during this period. The adolescent girls constitute around 1/10 of the Indian population. Undernutrition renders adolescents vulnerable to diseases. The risk, especially if you know, around 50% of adolescents are married before the legal age of marriage, as per the latest NFHS data, and already shows the fact. So this leads to there's a chance for adolescent pregnancy or teenage pregnancy, and the undernutrition along with this teenage pregnancy and undernourishment leads to high risk to the fetus, and it is a chance for lower weight baby. There is a chance for preterm delivery, even stillbirth, and also it's a chance for maternal mortality also. The objectives of the present study is to assess the nutritional status of adolescent girls in India and its states, and also examine the undernourishment among various social groups like SC, ST, and OBCs. So the results of the study shows that the prevalence of methodology is there. So if you examine the methodology part, the studies from the secondary data from the rapid survey on children conducted by the Ministry of Women and Child Development. They conducted studies around 1,54,000 households, and 67 and around 68,000 from rural and 38,000 from urban population. And they covered 28,000 adolescents also for the studies. Basically, there are different methods are used to assess the nutritional status. One is the BMI. It is the cheapest one, and it's a non-intervention is not required that much. But other method are dietary survey is there, and even the lab-oriented chemical test also there. But it's expensive compared to the BMI, the anthropometric studies. So the results of the studies shows that the prevalence of undernourishment in India is among the 10 to 80, even though the adolescents are considered 10 to 19. The prevalent in the study they considered only the 10 to 18 years. So I also restricted to consider this 10 to 18 years only. This around 62.5% of the adolescent girls in India are undernourished. And if you examine the later adolescent, that is 18, sorry, 19 is not correct, 15 to 18 years is 44.7%. And 3.5% of adolescents in the age group are overweight also. That means the 34% of the Indian adolescent girls are normal. If you examine the undernutrition among the various states, shows that the Rajasthan 74.4% of the adolescents are undernourished, and Goa it is 74%, Andhra Pradesh it is 68%, Karnataka it is 68.3%, Bihar 68%, Madhya Pradesh 64.5%, Odisha 64.5%, Himachal Pradesh 63.8%, Kerala 54.6%, and Tamil Nadu 50.1%. So I am not listing all the states. So again, the result shows that in rural area, the undernourishment is high compared to the urban area. 63.9% of rural adolescent girls are undernourished. That means they have the BMI less than 18.5. And in urban area, there's only 59%. Even though it is large, it's compared to rural area, in urban area, the overweight percentage is less. The adolescent girls from rural Rajasthan, Goa, and Andhra Pradesh reported high prevalence of undernourishment. 59.1% of adolescents from National Capital Territory of Delhi also were reported undernourishment. And again, the Rajasthan, Gujarat, Goa, the metropolitan cities in Goa, everything, the undernourishment is very high. 49.2% of tribal adolescent girls in the age group of 15 to 18 in India were undernourished. Tribal adolescent girls in Karnataka reported around 81.3% of adolescent girls among the tribal population in Karnataka were undernourished. 73% in Gujarat and 63% in Rajasthan. If you examine the adolescent SC population, SC adolescent girls in the age group of 15 to 18 shows that 46.7% are undernourished. It is high. In Nagaland, the SC adolescent underweight population is high, around 84% of the adolescent SC population were undernourished. In Rajasthan, it is 67.2%, and in Odisha, it is 56.1%. And if you examine the Madhya Pradesh data, 51.1% of the adolescent SC population were undernourished. If you examine the OBC population, 44.7% of population adolescent girls in the age group of 15 to 18 were undernourished. It is highest among the OBC group. This in Maharashtra, they have only 61% of adolescents are undernourished. So the recommendations of the studies are: it is required to formulate adolescent-friendly health strategies by incorporating nutrition components, and the involvement of grassroots level agencies like Panchayat Raj institutions for the nutritional development of adolescents. The behavioral change in the food habits of the adolescents also should be changed. And again, the health education and health promotion activities also promoted through the education institutions and even the adolescent Anganwadi centers. Thank you very much.